fear number 17, local anaesthetic. I've never come across an allergy of local anaesthetic in a single patient, although it's something which one that patients report regularly. And what we often find that there's actually a slight reaction that they've had to adrenaline previously. Now this would typically occur when they have an injection to numb up a lower tooth. Your typical injection in the lower tooth, the anaesthetic goes very close to a blood vessel, which soaks up a fair amount of adrenaline that then goes back to the heart, and they get, their heart starts beating very quickly, fastly, as in a palpitation. They feel lightheaded, they feel faint. Now, this is a very unpleasant experience for any patients, and there are particular syringes, especially syringes that we can use to avoid that occurring. We can tell that it's not, the injection is not into a blood vessel. With the quick sleeper that we use, we don't see that at all. Again, it's locally acting, we don't find the same problem. But with the adrenaline anaesthetics, they are more effective than the noradrenaline. So, the other way of doing it, there are some adrenaline synthetics that don't work quite as well, but can produce a good response to anaesthesia in patients who have a concern. Quite often a bit of distraction, making sure the patient has eaten that morning so that their blood sugar isn't too low. And that avoids the issue of any patients feeling faint or lightheaded. If it is the case that patients feel faint, then it's, we lie them back. If they've not eaten within the last couple of hours, we give them a glucose tablet. It gets their blood sugar back up again, and within 2 to 3 minutes they're back to their normal selves and ready to continue on with their treatment.